Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You will hear part of a consultation between a GP and a patient called Mr. Donovan. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Donovan. I'm Dr. Hamplin. What can I help you with today?
Hi, doctor. Well, I've been having some issues with my bladder, and I'm starting to get really worried about it.
I see. What kind of issues are you experiencing?
It's mostly this constant need to urinate, even when I don't actually have much to pass. And when I do go, it feels uncomfortable, almost like a sharp pain at the end.
Okay. And how long have you been dealing with this?
It started about a month ago, but the pain has gotten worse in the last couple of weeks. I didn't think much of it at first, but now it's happening pretty much every day.
That sounds unpleasant. Does the pain happen each time you urinate, or only occasionally?
Almost every time. Sometimes it's just uncomfortable, but other times it's more like a stabbing pain.
And where exactly do you feel the pain? Is it in your lower abdomen, or more towards the tip of the penis?
Mostly at the tip, but sometimes I feel a kind of heaviness in my lower abdomen, especially when I'm trying to urinate.
Right, I understand. Do you ever notice blood in your urine?
Yes, a few times actually. Not a lot. Just a bit of red when I wipe or in the toilet bowl.
That's important to note. Have you experienced any difficulty starting to urinate or stopping midstream?
Yeah, sometimes I have to really push to get started, and the flow is weaker than it used to be. And sometimes it just stops all of a sudden, and I feel like I haven't finished, but nothing more comes out.
Okay, those symptoms can sometimes suggest issues like bladder stones, or possibly something else affecting your urinary tract. Do you feel any pain in your back or sides?
Now that you mention it, I've had some dull pain in my lower back, but I thought it was just from lifting things at work. It comes and goes.
That back pain could be related, especially if it's affecting your kidneys or bladder. Do you find that certain activities or times of day make the symptoms worse?
It's hard to say, but I've noticed it's usually worse at night. I have to get up 2 or 3 times to use the bathroom, but nothing much happens when I do.
It sounds like nocturia, waking up at night to urinate, might be an issue for you. It could be related to incomplete bladder emptying, which can sometimes happen if bladder stones are blocking the normal flow of urine. Have you noticed any changes in how much water you're drinking?
I've actually tried drinking more water to see if it helps, but it hasn't really made a difference. If anything, it just makes me feel like I need to go more often.
Drinking water is good, but if there's a blockage, like a bladder stone, the extra fluid might not alleviate the symptoms as much as you'd expect. Do you feel any discomfort when drinking more fluids?
Not really discomfort, but it's frustrating because I drink more, and then I have to rush to the bathroom, only for it to hurt or barely come out.
That must be frustrating. Let me ask, have you had any other issues, like fevers, chills, or feeling generally unwell?
No fevers or anything like that. I've just been tired because I'm up a lot at night.
That's understandable. Given your symptoms, pain at the tip of the penis, frequent urination, the presence of blood in your urine, and the back pain, it's possible that you might have bladder stones. Bladder stones can form from concentrated urine that crystallizes, and they can cause these kinds of symptoms, including blockages that make urination difficult or painful.
Bladder stones? I've never heard of those. How do they form?
They often form when your bladder doesn't completely empty after you urinate, allowing minerals to build up and harden into stones. These stones can vary in size and can cause irritation, block the normal flow of urine, or lead to infections. Do you recall having any urinary tract infections in the past?
Not really, though I've had some burning in the past when I've had to pee, but it went away on its own.
That might have been an early sign of something. Bladder stones can sometimes develop slowly, especially if the bladder isn't emptying fully. We'd need to do a physical exam and possibly some imaging, like an ultrasound or X-ray, to check for stones. If we do find them, there are different treatments depending on the size and location of the stones.
What kind of treatments are there? Is it something that requires surgery?
In some cases, smaller stones can pass on their own with increased water intake. But if the stones are too large or causing severe symptoms, they may need to be removed. There are procedures like cystolitholapaxy, where we use a small scope to break up the stones. It's minimally invasive. Surgery would be a last resort, but we'll see what we're dealing with first.
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Mr. Gerald. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Gerald. I'm Dr. Wells, standing in for Dr. Whitfield today. I understand you're here to follow up on a concern regarding your chest area. Could you tell me a bit more about what's been bothering you?
Yeah, thanks for seeing me. It's just my chest. I noticed a couple of months ago, maybe 3 or 4 months, that it's gotten, I don't know, puffier. It feels strange, like there's more tissue there, and it's a bit sensitive.
I see. Has the sensitivity gotten worse over time, or does it come and go?
It kind of comes and goes. Sometimes it's tender, especially when I press on it or bump into something, but mostly it just feels like there's more tissue than usual. It's mainly around the nipples.
Right. I can understand how that might feel concerning. When you say more tissue, do you mean swelling, or does it feel more solid like a lump?
Not like a lump exactly. It's just fuller, kind of softer. I googled it a bit, and it seems like it could be something called gynecomastia. But I'm not sure.
You're correct that gynecomastia is one possibility. It refers to an increase in the glandular tissue of the male breast, and it's not uncommon. A lot of factors can cause it, ranging from hormonal changes to certain medications or even lifestyle factors. Have you noticed any changes in your health or habits lately?
Not really, nothing major. I mean, I've been trying to get into better shape, eating healthier and hitting the gym a bit more. Could that be related?
Exercise and diet are great, but they typically wouldn't cause gynecomastia. However, some changes in body fat can make the condition more noticeable. Have you experienced any significant weight loss or gain recently?
I've lost a bit of weight, but not a lot. I also had to change up some meds. I was on a new antidepressant a few months ago, but I didn't really like how it made me feel, so I stopped.
Medications, particularly antidepressants, can sometimes contribute to this type of breast tissue development. I'll make a note of that. We'll want to take a closer look at your overall health profile, including the medications you've been on. Have you noticed any other changes, like weight gain around the abdomen, fatigue, or any mood changes?
Not really. I've been a bit more tired, but I figured that's just stress. It's been a rough year.
Understandable. Stress can impact the body in many ways, but it's also worth considering your hormonal balance. Sometimes, gynecomastia is linked to an imbalance between testosterone and estrogen. Have you had any blood tests recently to check hormone levels?
No, nothing like that. Do you think I need one?
I think it would be a good idea. It's important to rule out any underlying issues, like low testosterone or higher than usual estrogen levels, both of which can contribute to breast tissue growth in men. Along with that, we might look at your liver function, as liver health can affect hormone balance.
All right, that makes sense. Is this something that's going to go away on its own, or will I need treatment?
It really depends on the cause. If it's related to hormonal changes, particularly if those changes are temporary or related to a medication, it could resolve on its own over time. However, if it persists, or if the tissue continues to grow, there are treatment options. Have you heard of any treatments for gynecomastia?
I saw some stuff online about surgery, but that seems like a last resort.
You're right. Surgery is usually reserved for cases where the condition doesn't improve or causes significant discomfort. Before we even consider that, there are other non-invasive treatments, including medications that can help balance your hormones. However, we'd first want to get those test results back to pinpoint the cause.
What kind of meds would that be? Are there side effects?
Depending on the hormone levels, we might use medications like tamoxifen or anastrozole, which can help reduce breast tissue in some cases. They're more commonly used in cases where the gynecomastia is due to an imbalance of estrogen. As with any medication, there can be side effects, but we'll weigh those against the benefits.
Okay. I'd prefer not to go down that road if I don't have to, but I'll do what's needed.
That's understandable. For now, the most important thing is to get a full picture of what's going on with your body. I'll order some blood tests, and once we have the results, we can talk through your options.
Sounds good. Should I be worried about anything more serious, like cancer?
It's natural to have that concern, but breast cancer in men is quite rare. Gynecomastia itself doesn't increase your risk, but we'll keep an eye on anything unusual, such as a hard lump, skin changes, or discharge from the nipple. If you notice anything like that, let us know right away.
I haven't noticed any of that, so that's a relief.
That's good to hear. Let's get those tests done, and we'll go from there. In the meantime, keep doing what you're doing in terms of staying active and eating well. If you notice any changes or discomfort, don't hesitate to come back in.
I will. Thanks, Dr. Wells.
You're welcome. We'll be in touch as soon as we have the results. Take care, Mr. Gerald.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse briefing about a patient. Now read the question.
Here, this is Laura Smith. She was brought in with a fractured wrist. She's in a lot of pain, and she's quite anxious about it. Last time she was here for a minor fracture, we managed it with just a splint, but this is more severe. I think a cast is needed this time. However, she's really struggling with the pain, and it might be difficult to apply the cast without addressing that first.
I see. Do you think we should start with some pain relief, maybe something stronger than ibuprofen this time?
Yes, I think a stronger painkiller would help her settle down, and then we can proceed with the cast.
Now look at question 26. You hear a scientist explaining CRISPR. Now read the question.
targeted changes to the DNA of living organisms. It works by utilizing a protein called Cas9, which acts like molecular scissors, cutting the DNA at a specific location. Once the DNA is cut, the cell's natural repair mechanisms can be used to add, remove, or modify the genetic material. This method has vast potential applications in various fields, including agriculture, where it could be used to create disease-resistant crops, and medicine, where it holds promise for treating genetic disorders such as cystic fibrosis or sickle cell anemia. However, there are still concerns regarding ethical issues and the potential for unintended consequences, especially when it comes to editing human embryos. More research and regulation are necessary before its full potential can be realized.
Now look at question 27. You hear a GP analyzing a patient. Now read the question. So, Mr. Thompson, it seems that your finger is still emitting that strong odor.
Oh yes, it still smells horrible. I've been cleaning it regularly, but the smell of rotting fish just won't go away.
I remember in your first visit you mentioned that the odor was foul, somewhat like decaying fish, and that there was redness and swelling. Are you experiencing any additional symptoms, like pain or fever?
Actually, yes. The finger's been throbbing with pain, and I've had a slight fever for the past couple of days.
Given these symptoms, I'm thinking it might be something more severe than an infection from a simple cut. Tell me, have you had any recent injuries, or handled something unusual? Perhaps in a wet or damp environment.
Well, I did accidentally scrape my finger on some old metal equipment while working near a water tank last week.
That could explain it. Based on your symptoms, I suspect you might have contracted a bacterial infection called Pseudomonas. This type of infection thrives in moist environments. Now look at question 28. You hear an orthopedic specialist talking to a patient about a knee brace. Now read the question.
Now that you've been wearing the brace for a few minutes, how does it feel?
It's not too bad. I was expecting it to feel tighter or uncomfortable, maybe even a bit stiff around my knee, but it's actually quite flexible. Though I do notice a little pressure around the sides.
That's normal. It just needs a bit of adjustment. Now, after a little while, I'll have you try taking it off and putting it on yourself.
I didn't have any issues taking it off earlier, but I'm still a bit worried about getting it on properly. I'm afraid I might not fasten it tight enough.
It's unlikely you'll have any problems with that.
But it does feel slightly off when I walk. It feels like it's not aligned right, and I'm not sure if it's giving my knee enough support.
Is it slipping, or does it feel unstable?
No, just not as supportive as I expected, especially when I put weight on it.
Let's make a few more adjustments and see if it improves.
Now look at question 29. You hear a conversation between a patient and a doctor. Now read the question.
Yes, I was diagnosed with high blood pressure around 6 months ago. I've been trying to manage it by changing my lifestyle, but it hasn't been as effective as I'd hoped. That's why I'm here today.
I see. Your last reading showed a blood pressure of 150 over 95 millimeters of mercury. A normal reading should be less than 120 over 80 millimeters of mercury. What have you done so far to manage it?
Well, I started walking 3 times a week for about 30 minutes, but I haven't been able to cut back on my salt intake, which I know is important for controlling my blood pressure.
I'm going to recommend that you...
Now look at question 30. You hear a conversation between a GP and a hospital administrator about managing patients with chronic diseases. Now read the question.
Is becoming more and more difficult, isn't it?
Yes, Dr. Harris. The demand for chronic disease care has grown significantly, but we simply don't have the necessary resources.
Exactly. We're struggling because we don't have enough specialists or the right facilities to provide comprehensive care.
And without dedicated facilities or staff, we can't properly manage these patients, which leads to more hospital admissions.
Yes, many of these patients need ongoing care that we just can't provide in our current setup.
It's affecting not just the patients, but also the quality of service we can deliver across the board.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1, questions 31 to 36. You hear Dr. Kate Benson presenting a case study. You now have 90 seconds to read questions.
Hello, I'm Dr. Kate Benson, a physiotherapist specializing in shoulder rehabilitation, and today I'd like to share a case study about a tennis player I worked with who had a severe rotator cuff injury. The patient, a highly competitive player in his early 30s, came to me after experiencing intense pain in his right shoulder, his dominant arm for playing. He had suffered the injury while serving in a match, and the pain was severe enough to prevent him from continuing. Despite resting for a couple of weeks and trying to manage the pain with over-the-counter medications, his range of motion had drastically reduced, and he couldn't perform overhead activities without sharp pain. When the patient arrived, my initial examination confirmed a rotator cuff tear. The tendons in his shoulder were inflamed, and there was notable weakness in his shoulder muscles, especially during abduction and external rotation movements. An MRI scan confirmed the diagnosis: a partial tear in the supraspinatus tendon, one of the 4 muscles that make up the rotator cuff. Additionally, there was some impingement of the shoulder, where the tendons were getting pinched between the bones during certain movements. The patient was understandably frustrated and concerned, as he had an important tournament coming up in 6 months. He feared the injury might keep him from ever playing at his previous level. I assured him that with proper rehabilitation, he could regain full function, but it would take time and effort. My first goal was to reduce his pain and inflammation.
We started with gentle mobilization exercises to improve the shoulder's range of motion. I also prescribed anti-inflammatory medications, and we used ice therapy after his exercises to reduce swelling. Over the next 2 weeks, his pain levels decreased, and we gradually introduced strengthening exercises focused on the rotator cuff muscles. This included isometric exercises, where he pressed his arm against a wall without moving the joint, building strength without risking further damage to the tendon. As his strength improved, we transitioned into resistance band exercises. These help target both the rotator cuff and the surrounding muscles that stabilize the shoulder joint. The key was to ensure he was performing these exercises with the correct technique, avoiding any compensatory movements that could aggravate his condition. For instance, I had him perform external rotations with a light resistance band, focusing on controlled movements to retrain his muscles. After 4 weeks of strengthening, I was pleased with his progress. However, the next step, returning to tennis-specific movements, was crucial. The repetitive overhead motions in tennis, particularly serving, are notoriously hard on the rotator cuff, so it was essential to rebuild his shoulder's endurance and stability. I introduced a modified serve drill, where he performed slow, controlled serve movements without a racket, paying attention to his shoulder alignment and mechanics. This helped reinforce proper movement patterns before we reintroduced racket work. Around the 12-week mark, we started incorporating light tennis drills. The patient began hitting forehands and backhands with low intensity, focusing on keeping his shoulder relaxed and his movements fluid. Serving was reintroduced cautiously, starting with half-speed serves before gradually progressing to full speed by the 15th week. Throughout this period, we maintained a rigorous shoulder strengthening routine, with a particular focus on scapular stabilization to ensure his shoulder blades were moving correctly during tennis strokes. One of the challenges was maintaining the patient's motivation during the long recovery process. To keep things engaging, I varied his exercises and drills regularly and set small, achievable goals each week. It was important for him to see steady progress, even if it was incremental, as this kept his confidence high. By the 5-month mark, the patient was playing competitive tennis again. While his serve still lacked some of its previous power, he was free of pain and playing without hesitation. Over the next few weeks, we worked on refining his serve mechanics, ensuring he didn't place undue strain on the shoulder. By the time his tournament arrived, he felt strong, and though he didn't win, he performed well, and was just happy to be back on the court without discomfort. This case highlights the importance of a structured rehabilitation program for athletes with rotator cuff injuries. By focusing on strengthening the shoulder muscles, restoring mobility, and gradually reintroducing sport-specific movements, we can help athletes return to their sport at a high level, while minimizing the risk of RE injury. Extract 2. Questions 37 to 42. You hear a conversation between a journalist and Dr. Walker discussing psoriasis. Now, read the questions. You now have 90 seconds to read questions.
Hello, Dr. Walker. Thank you for joining us today to discuss psoriasis. Can you start by telling us what psoriasis is?
Of course, it's my pleasure. Psoriasis is a chronic autoimmune disorder that causes the skin cells to grow too rapidly, leading to thick, scaly patches on the skin's surface. These patches, known as plaques, can appear anywhere on the body but are most often found on the elbows, knees, scalp, and lower back. The underlying issue is that the immune system mistakenly attacks healthy skin cells, causing them to build up too quickly, faster than the body can shed them.
Interesting. Is psoriasis common, or is it more of a rare condition?
Psoriasis affects about 2 to 3% of the global population, so it's fairly common. It can begin at any age, but it most often develops between the ages of 15 and 35. Certain environmental triggers, such as infections, stress, or skin injuries, can cause flare-ups, making the condition unpredictable. Although psoriasis is chronic, the severity can vary from mild to severe depending on the individual.
What about the different forms of psoriasis? I've heard there are multiple types.
Yes, there are several types. The most common is plaque psoriasis, which accounts for the majority of cases. These plaques are thick, raised areas of inflamed skin covered with silvery white scales. Another type, guttate psoriasis, presents as small red spots on the body and is often triggered by bacterial infections, like strep throat. Inverse psoriasis, on the other hand, tends to appear in skin folds, such as the armpits and groin, and has a smoother, less scaly appearance.
That must be very uncomfortable for the patients. Does psoriasis only affect the skin, or are there other health risks associated with it?
Psoriasis is more than just a skin condition. It can affect other areas of health as well. Up to 30% of psoriasis patients develop psoriatic arthritis, a painful joint inflammation. Additionally, psoriasis increases the risk for other chronic illnesses, including cardiovascular disease, diabetes, and even depression. The psychological effects can be profound due to the visible nature of the disease. Many patients experience anxiety, low self-esteem, and social isolation.
Can you talk us through some of the treatment options for psoriasis?
Certainly. Psoriasis can't be cured, but it can be managed. For mild cases, topical treatments such as corticosteroids, vitamin D analogs, and moisturizers are often effective. More severe cases might require phototherapy or systemic treatments like biologics or oral medications that target the immune system. One of my patients, David, had plaque psoriasis that spread to his scalp and hands, which was distressing due to its visibility. We shifted to a biologic treatment after his condition worsened. Thankfully, it helped reduce his symptoms significantly.
I imagine the mental health aspect is significant too. How do you address that?
Absolutely. The emotional toll of psoriasis is often underestimated. Many patients feel ashamed of their appearance or worry about what others think, which can lead to social withdrawal. It's vital to offer psychological support alongside medical treatment. Counseling and support groups can be incredibly beneficial for patients struggling with self-image and anxiety.
That is the end of Part C. You now have 2 minutes to check your answers.